You've been told you have PCOS and that you just need to lose weight and take the pill. But nothing's actually working. You're exhausted, frustrated, and honestly starting to wonder if your body is just broken. Well, I've got some news for you that might change everything. Hey everyone, I'm Dr. Michael Stevens, a nutritionist who helps people balance their blood sugar, improve their metabolic health, and understand their bodies on a deeper level. And today, we're diving deep into polycystic ovary syndrome, what actually causes it, and more importantly, what you can do about it. Now, if you watched my last video on insulin resistance, you already know that blood sugar control is absolutely foundational to metabolic health. But today, we're going to connect those dots specifically to PCOS. Here's the biggest misconception about PCOS that I see over and over again. People think PCOS is an ovarian problem. It's right there in the name, right? Polycystic Ovary Syndrome. So it must be about the ovaries. But here's the truth. Your ovaries are not the problem. They're the victim. PCOS is actually a metabolic and hormonal disorder that shows up in your ovaries, but the root cause is happening somewhere else entirely. And this is why the standard approach of just going on birth control doesn't actually fix anything. You're just masking the symptoms while the underlying problem continues to get worse. Let me explain what's really going on. Think of your body like a house with multiple rooms. When you have PCOS, there's a fire in the basement, but instead of putting out that fire, conventional treatment just closes the basement door and pretends everything's fine. Meanwhile, smoke is filling up the whole house. The ovarian cysts, the irregular periods, the excess hair growth, the acne, these are all just smoke. The fire is your metabolic dysfunction. And that's what we need to address. So what causes PCOS? Well, it's not just one thing. It's more like a perfect storm of factors that all feed into each other. But at the center of that storm for most women is insulin resistance. Now, I know you've probably heard this term thrown around, but let me break down exactly what it means and why it matters so much for PCOS. Insulin is a hormone your pancreas releases when you eat, especially when you eat carbohydrates. Its job is to act like a key that unlocks your cells so glucose from your food can get inside and be used for energy. That's normal. That's healthy. That's what's supposed to happen. But when you eat too much sugar, too many refined carbs, too frequently, for too long, your cells start to become numb to insulin's signal. It's like someone's been knocking on your door all day, every day, for months. Eventually, you stop answering. You become resistant to the knocking. So your pancreas has to produce more and more insulin to get the same effect. And here's where PCOS comes into the picture. High insulin levels don't just affect your blood sugar. They send signals to your ovaries to produce more testosterone. Yes, women naturally produce testosterone, but in PCOS, you're producing too much of it. And that excess testosterone is what causes many of the symptoms you're experiencing. The excess hair growth on your face and body, that's from testosterone. The acne, especially along your jawline, that's from testosterone. The thinning hair on your head, that's from testosterone being converted to DHT. And those ovarian cysts, they're actually follicles that started to mature but never fully released an egg because the hormonal signals got all mixed up. But it gets more complicated, because when you have insulin resistance, you're also dealing with chronic inflammation. Your body is in a constant state of low-grade stress, and inflammation disrupts the delicate balance of all your hormones. It affects how your body produces progesterone, how it metabolizes estrogen, how your thyroid functions. Everything is connected. Everything affects everything else. And here's another piece of the puzzle that most people don't talk about. Your gut health plays a massive role in PCOS. Your gut bacteria help metabolize hormones, regulate inflammation, and even influence insulin sensitivity. When your gut microbiome is out of balance, which we call dysbiosis, it can contribute to all the metabolic chaos that drives PCOS. Some women with PCOS have what we call leaky gut, where the lining of their intestines becomes more permeable than it should be, allowing partially digested food particles and bacterial toxins to leak into the bloodstream. And that triggers more inflammation, which worsens insulin resistance, which increases testosterone production. It's a vicious cycle. Let's talk about stress too, because this is huge. When you're stressed, your body produces cortisol, and cortisol does a couple of things that make PCOS worse. First, it raises your blood sugar. Your body thinks you're in danger and need quick energy, so it dumps glucose into your bloodstream. That means more insulin has to be released. Second, chronic high cortisol disrupts your other hormones, including your sex hormones. It can interfere with ovulation. It can worsen insulin resistance, and it creates more inflammation. So if you're constantly stressed, constantly running on adrenaline and coffee, never giving your body a chance to rest and recover, you're making it almost impossible for your body to heal from PCOS. Sleep is another factor that nobody wants to hear about, but absolutely cannot be ignored. When you don't get enough quality sleep, your insulin sensitivity tanks. Your hunger hormones get dysregulated, so you crave more sugar and carbs. Your stress hormones go up. Your inflammation goes up. One night of poor sleep can reduce your insulin sensitivity by up to 30%. Now imagine months or years of inadequate sleep. Your body cannot heal without proper sleep. It just can't. Now, I also need to mention that there are different types of PCOS. Not everyone with PCOS has insulin resistance. Some women have what's called inflammatory PCOS, where inflammation is the primary driver rather than insulin. Some women have post-pill PCOS, where their symptoms started after coming off hormonal birth control. And some women have adrenal PCOS, where the excess androgens are coming from the adrenal glands rather than the ovaries, usually because of chronic stress. But here's the thing. Even though there are different types, the approach to healing is actually pretty similar across the board. You need to reduce inflammation, balance blood sugar, support your hormones, heal your gut, manage stress, and optimize sleep. These are the foundations. Let me give you an analogy that might make all of this clearer. Imagine your hormones are like an orchestra. When everything's in balance, they create beautiful music. But PCOS is like having a conductor who's had too much coffee, can't keep the beat, and is giving everyone confusing signals. The violins are playing too loud, the drums are completely off rhythm. The whole thing sounds chaotic. Now, conventional treatment is like giving the violins earplugs so they can't hear that they're too loud. The problem is, the conductor is still chaos and the music still sounds terrible. What we need to do is calm down the conductor, get them back on track, and then the whole orchestra can start playing in harmony again. So how do we actually do that? How do we address the root causes of PCOS instead of just managing symptoms? Well, that's what the rest of this video is about. I'm going to give you a clear, step-by-step action plan that addresses all of these underlying factors. But before we get into the how, I want to make sure you really understand the why behind each of these strategies. Because when you understand why something works, you're way more likely to actually stick with it. Let's start with blood sugar and insulin. This is foundational for the majority of women with PCOS. If you can improve your insulin sensitivity, you will see improvements in almost every PCOS symptom. So what actually improves insulin sensitivity? Well, the most obvious answer is reducing your sugar and refined carbohydrate intake. But it's not just about eating less. It's about eating smarter. When you eat carbohydrates by themselves, especially refined carbs like bread, pasta, crackers, cereal, your blood sugar spikes really high, really fast. Your pancreas has to dump out a ton of insulin to deal with that spike. And then your blood sugar crashes, which makes you hungry and craving more carbs an hour or two later. It's a roller coaster. And that roller coaster is exhausting your pancreas and making your cells more insulin resistant every single day. But when you pair carbohydrates with protein, fat, and fiber, the absorption of glucose into your bloodstream is much slower and steadier. Your blood sugar doesn't spike as high. You don't need as much insulin. And you stay full and energized for way longer. So instead of eating a bowl of oatmeal for breakfast, you'd have oatmeal with almond butter, chia seeds, and a scoop of protein powder. Instead of snacking on crackers, you'd have crackers with cheese or hummus. Instead of pasta with marinara, you'd have pasta with chicken and vegetables and olive oil. You're not necessarily eating less food. You're just combining foods in a way that keeps your blood sugar stable. And that stable blood sugar means less insulin, which means less signal to your ovaries to produce excess testosterone. Fiber is especially important here. Most women with PCOS aren't eating nearly enough fiber. We should be getting at least 25 to 30 grams per day, but most people get like 15. Fiber slows down digestion, which stabilizes blood sugar. It feeds your good gut bacteria, which reduces inflammation, and it helps your body eliminate excess hormones, especially estrogen. So loading up on vegetables, especially non-starchy vegetables like leafy greens, broccoli, cauliflower, Brussels sprouts, zucchini, peppers, is one of the simplest and most effective things you can do. Now, some women with PCOS do really well on a lower carb approach. Not necessarily keto, which can be too restrictive and stressful for some people, but just reducing overall carb intake to maybe 100 to 150 grams per day, and focusing on getting those carbs from whole food sources like sweet potatoes, quinoa, berries, and plenty of vegetables. Other women do better with moderate carbs, but really focusing on that protein, fat, fiber combination with every meal. You have to find what works for your body. But here's what I see all the time. Women with PCOS are so desperate to lose weight that they go really low calorie and low carb at the same time. And that completely backfires. Because when you're not eating enough, your body interprets that as a threat. It thinks there's a famine. So it raises cortisol, which raises blood sugar, which requires more insulin. And it slows down your thyroid function to conserve energy. So now you're exhausted. You're more insulin resistant than before, and your metabolism has slowed to a crawl. You cannot starve your way out of PCOS. You have to nourish your way out. Let's talk about protein specifically, because this is so important and so overlooked. Protein is essential for blood sugar balance. It helps you feel full. It supports muscle mass, and muscle is one of the most insulin-sensitive tissues in your body. The more muscle you have, the better your insulin sensitivity. Protein also provides the building blocks for all your hormones. You literally cannot make hormones without adequate protein. And yet, so many women are barely eating any protein because they've been told to eat low-fat, or they think protein powder is only for bodybuilders, or they just don't prioritize it. You should be aiming for at least 20 to 30 grams of protein per meal. That's about a palm-sized portion of meat, fish, or poultry. Or if you're vegetarian, that's like a cup of Greek yogurt, 3 eggs, or a big scoop of protein powder. And you especially need protein at breakfast. Starting your day with protein, sets the tone for stable blood sugar all day long. It reduces cravings. It gives you sustained energy, and it signals to your body that you're not in starvation mode, which is so important for hormone production. Healthy fats are another critical piece. Your hormones are made from cholesterol and fat. If you're eating a low-fat diet, you're literally depriving your body of the raw materials it needs to make hormones. Plus, fat is satiating. It keeps you full. It slows down the absorption of glucose. And certain fats, especially omega-3 fatty acids, are powerfully anti-inflammatory. So we're talking about things like fatty fish, like salmon, and sardines, and mackerel, avocados, nuts and seeds, olive oil, coconut oil, grass-fed butter or ghee. These are not foods to be afraid of. These are foods that will help heal your PCOS. Now let's talk about inflammation, because this is the other major driver of PCOS symptoms. Even if you improve your insulin sensitivity, if you're still dealing with chronic inflammation, you're going to continue to struggle. So what causes inflammation? Well, a lot of things. Processed foods, especially those with industrial seed oils like soybean oil, canola oil, corn oil. Those oils are high in omega-6 fatty acids, which are pro-inflammatory when consumed in excess. And they're in everything: salad dressings, mayonnaise, restaurant food, packaged snacks. You have to read labels and start cooking more at home with better quality fats. Sugar and refined carbs are also inflammatory. They create oxidative stress in your body and feed bad bacteria in your gut, which then produce inflammatory compounds. Alcohol is inflammatory. Even moderate drinking raises inflammation and disrupts hormone metabolism. Chronic stress is inflammatory. We already talked about cortisol. Environmental toxins are inflammatory. Things like BPA in plastics, pesticides on non-organic produce, chemicals in personal care products. Your body has to detoxify all of that, and if it's overwhelmed, inflammation goes up. And then there's food sensitivities. This is controversial, and not everyone agrees, but in my experience, many women with PCOS have sensitivities to certain foods that create inflammation in their gut and throughout their body. Gluten and dairy are the most common culprits, not because they're inherently bad, but because they can be problematic for people with compromised gut health. And if you have PCOS, there's a good chance your gut health is compromised. So doing an elimination diet where you remove gluten and dairy for 4 to 6 weeks and then reintroduce them one at a time to see how you feel can be really eye-opening. Some women feel dramatically better without those foods. Others don't notice any difference, but it's worth experimenting. Anti-inflammatory foods, on the other hand, can be incredibly healing. We're talking about colorful vegetables and fruits, especially berries, which are packed with antioxidants. Fatty fish with omega-3s, turmeric and ginger, which are potent anti-inflammatory spices. Green tea, dark chocolate in moderation. Bone broth, which supports gut healing. These foods should be staples in your diet. Now, gut health. I mentioned this earlier, but let me go deeper because it's so important. Your gut is home to trillions of bacteria, and those bacteria do way more than just help you digest food. They produce vitamins. They regulate your immune system. They communicate with your brain. They metabolize hormones. And when the balance of bacteria is off, when you have too many bad bacteria and not enough good bacteria, it creates a cascade of problems. You get more inflammation. Your gut lining becomes damaged. You develop food sensitivities. You don't absorb nutrients properly. And all of that makes PCOS worse. So how do you heal your gut? Well, first, you have to stop damaging it. That means reducing sugar, which feeds bad bacteria. Avoiding unnecessary antibiotics, which wipe out good bacteria along with bad. Managing stress, which disrupts the gut lining. And avoiding inflammatory foods that irritate your digestive system. Then, you need to actively support gut healing. Probiotic-rich foods like sauerkraut, kimchi, kefir, yogurt can help repopulate good bacteria. Prebiotic foods like garlic, onions, asparagus, bananas feed the good bacteria. Bone broth and collagen can help repair the gut lining. And for some people, taking a high-quality probiotic supplement is beneficial, especially if they've taken a lot of antibiotics in the past or have significant digestive issues. Alright, let's talk about stress, because I know you're probably tired of hearing that you need to reduce stress. Everyone says it, but nobody really explains why it's so critical for PCOS or how to actually do it. So here's the deal. When you're stressed, your hypothalamus, which is like the command center in your brain, sends a signal to your pituitary gland, which then signals your adrenal glands to produce cortisol. That's the stress hormone. And in the short term, that's actually a good thing. Cortisol helps you respond to immediate threats. It gives you energy and focus. But when stress is chronic, when that cortisol is elevated day after day, it wreaks havoc on your entire endocrine system. Chronically high cortisol suppresses your reproductive hormones. It tells your body that now is not a safe time to get pregnant because you're in survival mode. So ovulation gets disrupted. Your progesterone production drops. Your cycle becomes irregular or stops altogether. High cortisol also increases insulin resistance. It raises blood sugar. It promotes fat storage, especially around your midsection. It disrupts sleep. It increases inflammation. Basically, it makes every aspect of PCOS worse. And here's the kicker. The symptoms of PCOS themselves are stressful. You're dealing with unwanted hair growth, acne, weight gain, fertility concerns. So you're stressed about being stressed, which creates more cortisol, which makes everything worse. It's a vicious cycle. So how do you actually manage stress? Well, you can't eliminate stress completely. That's not realistic. But you can change how your body responds to stress. And that starts with activating your parasympathetic nervous system, which is your rest and digest mode. When your parasympathetic nervous system is active, cortisol goes down, inflammation decreases, digestion improves, and your body can heal. So what activates the parasympathetic nervous system? Deep breathing, meditation, yoga, gentle walks in nature, spending time with people you love, laughing, playing, anything that makes you feel calm and safe. Now I know some of you are rolling your eyes right now, thinking meditation isn't for you. And that's fine. You don't have to sit in lotus position chanting Om. But you do need to find some way to signal to your nervous system that you're safe. For some people, that's taking a bath. For others, it's reading a book, or listening to music, or gardening, or painting. The activity itself doesn't matter as much as the feeling it creates. You need pockets of calm in your day where your nervous system can down-regulate. And you need to look at the sources of stress in your life and see what can actually change. Are you working 60 hours a week? Can you set better boundaries? Are you in toxic relationships? Can you create distance or have honest conversations? Are you constantly on your phone, scrolling through social media, comparing yourself to everyone else? Can you put the phone down? Sometimes stress is circumstantial and genuinely hard to change. But often, we're creating a lot of unnecessary stress through our choices and habits. And those are the things we actually have control over. Sleep. We have to talk about sleep, because you cannot reverse PCOS without adequate sleep. When you sleep, your body does all of its repair work. It processes hormones. It clears out inflammatory waste products from your brain. It regulates hunger hormones. It restores insulin sensitivity. Sleep is when healing happens. And when you're not getting enough sleep, or the sleep you're getting is poor quality, your body simply cannot do what it needs to do. You wake up more insulin resistant than when you went to bed. Your cortisol is elevated. Your hunger hormones are out of whack, so you crave sugar all day. Your immune system is suppressed. Your mood is terrible. Everything is harder. So how much sleep do you need? Most people need 7 to 9 hours. And it's not just about duration. It's about quality. Are you falling asleep easily? Are you staying asleep? Are you waking up feeling rested? If the answer is no, then we need to optimize your sleep hygiene. That means going to bed and waking up at the same time every day, even on weekends. That means making your bedroom dark, cool, and quiet. That means avoiding screens for at least an hour before bed, because the blue light suppresses melatonin. That means not eating a huge meal right before bed. That means limiting caffeine, especially in the afternoon. That means managing stress during the day so your mind isn't racing when your head hits the pillow. Some women with PCOS also have sleep apnea, which is when your breathing stops and starts throughout the night. This is more common in women with PCOS because of the metabolic dysfunction and weight gain that often comes with it. If you snore loudly, wake up gasping, or feel exhausted even after 8 hours of sleep, talk to your doctor about getting a sleep study. Sleep apnea severely disrupts your sleep quality and worsens insulin resistance and inflammation. Exercise. This is another piece of the puzzle that's important but often misunderstood. Exercise improves insulin sensitivity. It reduces inflammation. It helps with stress management. It supports weight loss, if that's a goal. It improves mood. All of that is great, but here's where women with PCOS often go wrong. They think more is better. They start doing intense workouts every single day. HIIT classes, long runs, boot camps, and their bodies are already stressed. They're already producing too much cortisol. And intense exercise, especially when done too frequently without adequate recovery, is a stressor. It raises cortisol. And for some women with PCOS, that can actually make things worse. So what's the right approach? Well, it depends on where you're starting from. If you're currently sedentary, any movement is beneficial. Start with walking. 30 minutes a day. That's it. Walking is incredibly underrated. It improves insulin sensitivity without spiking cortisol. It's easy on your joints. You can do it anywhere, and it activates your parasympathetic nervous system, especially if you're walking outside in nature. As you build consistency, you can add in strength training. Lifting weights is one of the best things you can do for PCOS because it builds muscle, and muscle is metabolically active and improves insulin sensitivity even when you're resting. You can also incorporate some higher intensity exercise, but it should be strategic and not excessive. Maybe 2 to 3 times per week max. And you need rest days. Your body repairs and adapts on rest days. If you're working out intensely every single day and still struggling with PCOS symptoms, that's a sign you need to pull back. Movement should make you feel better, not more exhausted. Supplements. I'm going to talk about supplements, but I want to be clear that supplements are supplemental. They're not a replacement for the foundational work of eating well, managing stress, sleeping enough, and moving your body. That said, there are some supplements that can be really helpful for PCOS. Inositol is probably the most well-researched supplement for PCOS. It improves insulin sensitivity, supports ovulation, and can help with egg quality if you're trying to conceive. The typical dose is a combination of myo-inositol and D-chiro-inositol. Magnesium is another important one. Most people are deficient in magnesium, and it's involved in hundreds of processes in the body, including blood sugar regulation and stress management. Omega-3 fatty acids reduce inflammation and improve insulin sensitivity. Vitamin D is crucial for hormone production and immune function, and many women with PCOS are deficient. Zinc supports hormone balance and can help with acne and hair loss. Berberine is a plant compound that improves insulin sensitivity similarly to metformin. N-acetylcysteine, or NAC, can improve insulin sensitivity and egg quality. And spearmint tea has been shown to reduce testosterone levels in women with PCOS. Now, I'm not saying you need to take all of these. That would be overwhelming and expensive. But working with a healthcare provider to identify your specific deficiencies and needs can be really valuable. Some people benefit tremendously from targeted supplementation. Others not as much. It's very individual. Okay, so we've covered a lot of ground. We've talked about insulin, inflammation, gut health, stress, sleep, exercise, and supplements. Now let me give you a clear, step-by-step action plan that brings all of this together. These are the concrete steps you can start implementing today to start reversing your PCOS. Step 1. Balance your blood sugar at every meal. This is the foundation. Every time you eat, pair carbohydrates with protein, fat, and fiber. Stop eating naked carbs. Start your day with a high-protein breakfast within an hour of waking up. Aim for at least 20 to 30 grams of protein. Eat every 3 to 4 hours to keep your blood sugar stable and prevent that crash and crave cycle. And don't skip meals. Skipping meals might seem like a good way to eat less, but it actually creates blood sugar instability and raises cortisol. Step 2. Reduce inflammatory foods and increase anti-inflammatory foods. Start by cutting out or dramatically reducing added sugars and refined carbohydrates. Read labels. Sugar hides under dozens of different names. Then, look at the fats you're consuming. Swap out industrial seed oils for olive oil, avocado oil, coconut oil, butter, or ghee. Eat fatty fish at least twice a week, or take a high-quality fish oil supplement. Load up on colorful vegetables at every meal. Add turmeric and ginger to your cooking. Drink green tea, and consider doing a 4 to 6 week elimination of gluten and dairy to see if that makes a difference for you. You can always add them back later if you don't notice any benefit. Step 3. Support your gut health. Start eating at least 1 serving of fermented foods daily. Sauerkraut, kimchi, kefir, yogurt, whatever you enjoy. Include prebiotic foods like garlic, onions, asparagus, and slightly underripe bananas. Consider taking a high-quality probiotic if you have digestive issues or a history of antibiotic use. And think about adding bone broth or collagen powder to support gut lining repair. Step 4. Manage your stress. This is non-negotiable. Find at least one daily practice that helps you feel calm. It could be 10 minutes of deep breathing, a short meditation, a walk outside, journaling, whatever works for you. The key is consistency. It has to be daily. Identify your biggest sources of stress and see what's actually within your control to change. Set boundaries. Say no more often. Get off social media if it's making you feel worse. And stop over-exercising if you are. Exercise should reduce stress, not add to it. Step 5. Prioritize sleep like your health depends on it, because it does. Set a consistent sleep schedule. Create a bedtime routine that helps you wind down. Make your bedroom a sleep sanctuary. Address any underlying sleep issues, like sleep apnea, if you suspect you have them. And stop sacrificing sleep for other things. It's not worth it. Step 6. Move your body in a way that supports your hormones. If you're sedentary, start walking daily. Build up to at least 30 minutes. Add in strength training 2 to 3 times per week. You can start with body weight exercises at home if you don't have access to a gym, and incorporate some higher intensity movement if you enjoy it. But keep it to 2 to 3 sessions per week and make sure you're taking rest days. Listen to your body. If you're exhausted all the time, you need more rest, not more exercise. Step 7. Consider targeted supplementation. Work with a healthcare provider to test for deficiencies and determine what supplements might be beneficial for you. At a minimum, most women with PCOS benefit from inositol, magnesium, vitamin D, and omega-3s. But again, this should be personalized based on your specific situation. Now, I want to be really honest with you. Implementing all of these changes at once can feel overwhelming, and overwhelm leads to inaction, which doesn't help anybody. So, I want you to start small. Pick 1 or 2 things from this list that feel most doable right now. Maybe it's adding protein to your breakfast and going for a daily walk. Just those 2 things. Do them consistently for 2 weeks. Once they feel like habits, add another one. Maybe you start eating fermented foods daily, or you establish a bedtime routine. Build slowly. Be patient with yourself. This is a marathon, not a sprint. And please understand that you didn't develop PCOS overnight, and you're not going to reverse it overnight either. It takes time. For some women, they start seeing improvements within a few weeks. For others, it takes months. And that's okay. Your body has been in a state of dysregulation for a while. It needs time to heal. But the beautiful thing is that every single positive change you make is moving you in the right direction. Every blood sugar balanced meal is healing. Every good night of sleep is healing. Every stress management practice is healing. It all adds up. I also want to address weight loss for a second, because I know that's a huge concern for many women with PCOS. Here's the truth. When you do these things, when you balance your blood sugar, reduce inflammation, support your gut, manage stress, and sleep well, weight loss often happens naturally as a side effect. Your metabolism starts working better. Your hormones balance out. Your body feels safe enough to let go of excess weight, but it might not happen as quickly as you want. And that's frustrating. I get it. But obsessing over the scale and trying to force weight loss through extreme restriction or excessive exercise will backfire. It will make your PCOS worse. So I need you to shift your focus from weight loss to metabolic health. Track how you feel. Track your energy levels. Track your skin. Track your cycle. Those are the real markers of healing. And if the weight comes off in the process, great. If it takes longer, that's okay too. You're still getting healthier. One more thing I want to mention. Some women will do all of these things and still need medication. And that's okay. There's no shame in that. Metformin can be helpful for insulin resistance. Spironolactone can help with excess androgens. Letrozole or Clomid can help with ovulation if you're trying to conceive. These medications are tools. They're not failures. The goal is to do everything you can with lifestyle, and can add medication if you need additional support. It's not one or the other. It's both. Do the lifestyle work first, because that's going to make any medication you take work better. But don't beat yourself up if you need pharmaceutical help. I also want to say that PCOS is complex. What I've shared with you today is based on research and my clinical experience working with hundreds of women. But your body is unique. What works for someone else might not work exactly the same way for you. That's why it's so important to pay attention to how your body responds and to work with healthcare providers who understand PCOS and are willing to look at root causes, not just hand you a prescription for birth control and send you on your way. And speaking of working with your body, I want you to start developing a better relationship with it. So many women with PCOS feel like their bodies have betrayed them. They feel broken. They feel frustrated and angry, and I understand that. But your body is not your enemy. It's trying its best to function in an environment that's making it really hard. It's responding to signals. And when you change the signals, by changing what you eat, how you move, how you sleep, and how you manage stress, your body will respond. It wants to be healthy. It wants to feel good. You just have to give it what it needs. This journey is not easy, but it is possible. I have seen women completely transform their PCOS through these exact strategies. I've seen women get regular periods for the first time in years. I've seen women clear their skin, lose weight, grow back their hair, balance their moods, improve their energy, and yes, even get pregnant when they were told it wasn't possible. It happens, and it can happen for you too. But you have to be willing to do the work. You have to be patient. You have to be kind to yourself when you mess up. Because you will mess up, and that's okay. Just keep going. PCOS is not a life sentence. It's not something you just have to live with and manage symptoms forever. You have so much more control than you've been led to believe. And every choice you make, every meal, every workout, every hour of sleep, every moment of stress management, it all matters. It's all contributing to your healing. So start today. Start small. Build momentum. Trust the process. And know that your body is capable of amazing things when you give it the support it needs. If you found this video helpful, I highly recommend checking out my previous video on insulin resistance, where I go even deeper into blood sugar management and how to know if you're insulin resistant. Understanding that foundation will make everything I talked about today make even more sense. Thanks guys for watching, and I'll see you in the next one.